In this video, we're going to look at Higher Human Biology, Unit 2, Physiology and Health, Key Area 3, Antenatal and Postnatal Screening. This video mainly covers the first sub-key area A. So we're going to look at why antenatal screening tests have to be carried out, describe what the dating and anomaly scans are, when they're carried out and what the purposes are, why blood and urine testing is carried out, and again, what the purpose of this is, and compare the advantages and disadvantages of amniocentesis and chorionic villus sampling. So, antenatal screening. There's two different scans that are carried out during antenatal screening. When we talk about antenatal screening, this just consists of all the testing, scanning, consultations done prior to the birth of the baby. In pregnant women, there are two particular ultrasound scans that are carried out. There's the dating scan and the anomaly scan. We can also do complementary testing of blood and urine. These look for chemicals that aid in the diagnosis of medical conditions in the fetus. So if you do these at the wrong time, you could get a false positive result, which means that you are told by your doctor or technician that your child is likely to have a certain genetic condition that they actually do not have, which is obviously not all that good. So it's best to do these tests at the right time. The two scans are the dating and the anomaly scan. So the dating scan, again, is done from ultrasound, and it determines the pregnancy stage and date. So we try and do these between about 8 and 14 weeks. You might think, this is slightly out with the course content, wait a minute, if this scan is telling me how far along I am, how do I know I'm 8 to 14 weeks? We use the date of the last period as our starter mark for 0, and we count up from then. So women will make a reasoned decision about roughly when they think they are at 10 to 12 or 8 to 14 weeks, and at that point they will go for their scan. Later on, between 18 and 20 weeks, so it's a narrower window, they will have the anomaly scan. So in this case, we're looking for any physical abnormalities in the fetus. At this point, quite often, we'll also be able to get a better look at the genitals and gender of the child. So in antenatal screening, we have amniocentesis and chorionic villus sampling. So these are slightly more invasive tests that not every pregnant woman will go through. Each of them has its own advantage and disadvantage. So amniocentesis, you have to wait until later in the pregnancy to have this technique. What happens is a needle, as you can see in the diagram here, is driven through the wall of the abdomen and into the fluid in the amniotic sac, and some of the fluid is drawn out. In this fluid, there are cells of the fetal tissue, and these can be grown up in the lab and used to make what's called a karyotype. So a karyotype is just a picture of all the chromosomes in homologous pairs that individual has. And you can see any obvious deletions or duplications that are caused by something called translocation, disjunction. So amniocentesis, as I said, it's got a lower rate of causing a miscarriage than what's called chorionic villus sampling, but you have to wait a little bit longer into pregnancy. CVS, chorionic villus sampling, you can do it earlier, but it has a higher likelihood of causing a miscarriage. This is because it's slightly more invasive. So the tube is passed up through the vagina, cervix, into the uterus, and then cells of the placenta are taken. It really depends how urgent the need is to have the sampling done. In deciding to proceed with these tests, the element of risk will be assessed, as the decision that the individual will make in the event of a positive result is quite important. If the individual has no plans on terminating this pregnancy, regardless of what the results are, it might be felt that risking a miscarriage by carrying out the tests wasn't worth the risk, considering the person is not going to make any changes based on the result. Whereas if someone maybe had a history of having pregnancies with fetal abnormalities that weren't compatible with life, it might be more important for them to go through one of these techniques. So we should know what antenatal scans are carried out. We have the dating scan, which is carried out at 14 8 to 14 weeks. This is to give us the pregnancy stage and due date. We have the anomaly scan, which is carried out between 18 and 20 weeks. This detects physical abnormalities in the fetus. The blood and urine testing can help with this. It's carried out at the same time as these scans, and it measures the chemicals to tell you if it's likely that the fetus has a medical condition. If you measure them at the wrong times, it can give a false positive result. So you could think your fetus has a condition that it does not have. The advantages and disadvantages of amniocentesis and chorionic villus sampling. Amniocentesis, you have to wait a little bit longer to have it, but it's less likely to cause a miscarriage. And chorionic villus sampling, you can do it earlier, but it's more invasive, so more likely to cause a miscarriage. Hopefully that made sense. If it doesn't, please do ask for further information.